Hello and welcome, everyone. I hope that you're having a lovely day on this beautiful sunny October day. Um, I'm just going to let everyone know that we are recording today's session. So welcome to today's session. Today, we are presenting a session as part of our Breast Cancer Awareness Month webinar series. My name is Laura Hutchinson, and I'm the Director of BreastScreen Southeastern Sydney, Illawarra. I would like to acknowledge the Bidjigal people, who are the traditional custodians on whose lands I am on today, and acknowledge the traditional custodians of the lands of where you are joining me from today. We pay our respects to elders past and present and those of the future. I would also like to acknowledge and welcome any Aboriginal staff present for today's webinar. As you're all aware, October is Breast Cancer Awareness Month, and during the month of October, we are presenting a webinar series to share with you, our wonderful colleagues across CESLED and ISLED, more information about the BreastScreen program. This webinar is the second in a series of 5 webinars, and all the webinars will be recorded and accessible from the BreastScreen Southeastern Sydney intranet page. Today's webinar is titled The Role of Health Professionals to Promote BreastScreen. We will discuss some myths around breast cancer, preventative health, and how to start the conversation with your patients about the BreastScreen program. Throughout the presentation, please feel free to pop questions or comments in the chat box. And additionally, we'll have time at the end of the presentation for any questions. Presenting on this excellent topic today is Denise Chapman. Denise is passionate about health promotion and public health. As an accredited dietitian, Denise's professional interests include developing and evaluating interventions for health professionals to influence the behaviour of their clients and patients. The role of diet, physical activity, and alcohol consumption and the relationship with cancer has always captured Denise's attention, which has drawn her to now working as the Health Promotion Manager for BreastScreen Southeastern Sydney, Illawarra. Denise is extremely approachable, knowledgeable, and engaging, and she is a wonderful advocate for BreastScreen and collaborative working within the districts and across the community. It gives me great pleasure to hand over to Denise for today's presentation.
Yes, I'm just really excited to talk to you about the role of health professionals. And as I was just discussing and doing our acknowledgement of country. And I'd also like to talk about the BreastScreen New South Wales artwork that BreastScreen New South Wales had commissioned with Jasmine Sarin as the artist. And this is an Aboriginal artist who's produced this artwork reflecting the journey we're all on as women. Some become mothers, some women becoming mothers, aunties, grandmothers and sisters, and the community that we live in, supporting health and wellbeing. So the communities for Aboriginal people, this artwork represents the women's groups and women's groups talking about women's business, health and wellbeing. And part of that yarn does mean talking about breast screening and breast cancer. So I did just want to show this artwork and mention that that is a really exciting artwork that we very proud to display. You might see it at some of our BreastScreen clinics should you attend. Okay, so let's just have a quick touch base talking at some of the facts about breast cancer. Each year, over 20,000 women and 200 men in Australia will be diagnosed with breast cancer. The risk of being diagnosed with breast cancer over a lifetime is 1 in 7 for women, and breast cancer accounts for 28% of all new cancers in Australian women. And each year, 3,000 women in Australia will die from breast cancer, and 30 men. So some of our discussion today will be about how health professionals can influence decisions to participate in breast screening. And I am very, very excited about the role of health professionals to have discussions with women about where they're up to with their breast screening. Are they a current participant in our program for BreastScreen New South Wales? Or are they someone who, in fact, is not screening? Or what are some of that for each woman that you're talking to? What are the thoughts around breast screening? So the things that health professionals can do is to be able to describe how family history affects decisions on screening intervals. This is a particularly important area to be able to talk about, and I'll go into that in a bit more detail today. Knowledge of the service and program, just having a knowledge of how BreastScreen is structured, and I'll talk also about that. Be aware of some attitudes that are barriers to participation and how to investigate those in your discussions with clients or patients. And how to be prepared to discuss and bust the myths of breast screening. So I'm going to talk about those during this presentation, and how you can increase your knowledge of how to access and arrange a breast screening appointment for your clients or patients, and how to ensure that you even think about some of the supports that might be required to really make sure that woman does attend her appointment. So just looking firstly at some of the evidence that we do have, this is a recent publication, recent article, which is a study where there was 14 focus groups with 80 participants, and there were women aged 50 to 74. And this was looking at barriers and facilitators to participate in breast, bowel and cervical cancer screening. It's by Azar et al. And a really interesting range of themes discussed in the outcomes from these focus groups. So in relation to breast screening, participants often required multiple prompts before they take action, and that's really what we are wanting to encourage all health professionals to take on, having these discussions around breast screening. And breast cancer was known to be reasonably common, and this is this as a reason to screen. So not having a family history of breast cancer was sometimes a common reason for women to avoid screening. So what about family history? Let's just delve into it a little bit for a moment. Most women who develop breast cancer do not actually have a family history of the disease. So for women who do not have a family history of breast cancer may, in fact, have the false confidence that breast screening is not as relevant to them, or they don't need to be a participant in the breast screen program because it's not in their family. So that really is something to, if you're chatting to a woman who's actually saying that they're not intending to breast screen, it may be worth looking at what the attitudes are in relation to family history. So just wanting to update you and make sure that this is information, it is available on the BreastScreen New South Wales website. I do suggest having a look at the website, the many pages. There's a lot of information there. So for family history, it may be recommended that a woman has an annual breast screen from age 40 if she has a first-degree relative, such as a parent, sibling or child, diagnosed with breast cancer before age 50. Or if she's assessed by BreastScreen New South Wales as needing more frequent monitoring. Sometimes BreastScreen New South Wales will directly recommend that to clients, or if she's assessed by her doctor as being high risk. So these are some of the reasons that it could be suggested that there's an annual breast screen from age 40. Otherwise, breast screening is suggested every 2 years. We invite women 50 to 74 to screen every 2 years, and women aged 40 and over are also able to attend. So if a woman has a blood relative diagnosed with breast cancer over 50 years old and no other contributing factors, then that woman is at similar risk to developing breast cancer as the general population, and she'll be offered a breast screen every 2 years. So we really do suggest for women to speak to their doctor if there is a concern about family history. And I think doctors are well placed to have those discussions with individual patients and to hone in on whether or not there is in fact a higher risk relating to that particular patient. So 9 out of 10 women with breast cancer do not have a family history of breast cancer. And breast cancer is common, and most breast cancers are not caused by known genetic factors. And most women who develop breast cancer do not have a family history of the disease. Only around 5% of breast cancers are due to a strong family history or genetic mutations such as the BRCA1 or 2 gene. So I think this is a really important aspect to highlight, because we really need to ensure that the women that we're talking to are not, under the false illusion that they don't need to be screening because they don't have that family history. So I just thought I'd talk a little bit as well about our BreastScreen New South Wales population-based screening program. It's part of BreastScreen Australia, a joint Commonwealth and state and territory initiative. And as I mentioned, we invite women from age 50 to 74 to breast screen every 2 years. Women aged 40 to 49 and over 74 are also welcome to attend. And we target Aboriginal women and from age 40 to 74. And the benefit of screening for Aboriginal women 40 to 74 and for the other population 50 to 74, that is the highest benefit from screening, and that's why we target that particular age group. And the program is designed for women without symptoms, so no breast symptoms. If women do have breast symptoms, we suggest they make sure they do go to their GP, discuss the symptoms with their GP, and be advised from there in terms of where to attend for their screening service. So just looking at early detection, BreastScreen New South Wales aims to reduce illness and death from breast cancer by detecting the disease early. And this, in fact, increases the treatment options for women and increases the chances of survival. And look, it's a great success story. I mean, we've had this 45% reduction since the program commenced in 1991 of the breast cancer death rate, an absolute reduction in that death rate. Our overarching program goal is to achieve 55% of New South Wales women to screen every 2 years. Now, just wanting to mention as well, you may have joined our webinar last week about that Fiona Biniakis presented about mammography in the BreastScreen program, but just wanting to highlight, in case you're not aware, that we have these 2 different arms of the program. So we have the screening stage, which is the initial stage of the program, which is 2D mammography, and that appointment will take 20 minutes. It's a short appointment. It's at many different locations. We have services spread throughout Southeast Sydney and Illawarra, Shoalhaven, and so that's the first stage of the service. There is another part of the service which is called the assessment clinics, or the assessment service. So we are both a screening and assessment service. The assessment clinics can take 2 to 4 hours, and there will definitely be additional mammography that's involved in the assessment clinic, and there may also be some of these other procedures. So there can be breast ultrasound, there can be a clinical breast examination, and there can also be needle biopsy if it's required. So that is a longer appointment, and it's a much smaller proportion of women that are brought back to assessment clinics. And if any clients or patients that you're speaking to do have a call back to an assessment clinic, it does not mean that they have breast cancer. And it's really important to discuss that and have that supportive conversation with any women that are called back to assessment clinics, and just to highlight that it is for further assessment and further diagnostic testing. And it does not mean necessarily that there will be breast cancer detected. So I just wanted to talk a little bit about this report, which is a final report, Understanding Informed Decision Making for Breast Screening, by Gribble, Haseman, Welsh and Bishop. And it's a literature review, stock take of current resources and communication, and stakeholder insights about Australian women's attitudes to participating in population-based breast screening. And just it's a fantastic report, but of course, honing in on what are the things that we can really focus in on here in our communication and in our work with our clients and patients to ensure that we're looking at these hotspots, these things that we need to be addressing. So women do not correctly understand increasing age as a strong risk factor for breast cancer. And so this affects women's ability to understand the age of the eligibility parameters for the program. So we do a lot of work communicating about the age at which women can commence breast screening. Women can start to attend BreastScreen New South Wales from age 40. We invite women from 50 to 74, and we target Aboriginal women from 40 to 74. So there is not always a full understanding of the age at which to start breast screening. So that's something to check with your clients with your women that are female clients that are 40 and above. Check whether or not they're screening. Family history is another thing that's misunderstood, and I've spoken about that. So this is highlighted in this report, that women without a family history are likely to underestimate the risk of developing breast cancer, and women with a breast cancer diagnosis have a better understanding than those without. So women generally have a poor understanding of what is meant by family history, the actual how we define whether or not a woman is at high risk. I'm going to talk a little bit more about some of the tools that are available for women to assess their risk. So another thing that women are not really sure of is modifiable risk and protective factors. So some women understand that there are modifiable risk and protective factors, particularly HRT, but there appears to be confusion about alcohol consumption. So there is information on the BreastScreen New South Wales website. I do direct you there again. That is talking about how women can manage their breast cancer risk. So if you have clients or patients that you're talking to and they're concerned about their own risk of breast cancer, you can direct them to that information on the website. And this is just an example. We have information there about limiting alcohol intake, maintaining healthy body weight, engaging in physical activity. These are all risk factors, or if women are not engaging in regular physical activity, they're at higher risk. So these are things, positive things that women can do to reduce their risk of breast cancer, and it is useful to include that in your communication about breast cancer. There's some other detail there about menopausal hormone therapy, and also breastfeeding can reduce the risk. So we do have some online tools that women can access. There's this iPrevent tool is the recommended tool. It's also recommended by the Royal Australian College of General Practitioners. So that means that GPs will be well versed in this particular tool, and they will be able to GPs will be able to have these conversations with women once they've completed this tool. So you can suggest that women that you're talking to can come online onto this iPrevent. You can just Google iPrevent. It's a Peter McCallum. It's sitting on the Peter McCallum website, and it's an online assessment tool. So each woman can just go through, fill out each of the things that are asked, and then it will let that woman know whether or not she's at a regular level of risk or at higher risk than the general population. So some of the data entry that's asked about is things like reproductive factors, lifestyle factors. It does ask about physical activity levels. It does ask about height and weight. History of previous breast disease, particularly lobular carcinoma in situ or atypical hyperplasia. Family history of breast, ovarian, prostate and pancreatic cancer, including age at diagnosis, is collected. And so once the data entry is then complete, this tool called iPrevent uses the inputted information to estimate breast cancer risk using one of two well-validated evidence-based mathematical algorithms. And the risk that is allocated will be either average risk, so the woman will be told she's at average risk, or at moderate risk, or at high risk. And these outcome reports then can be taken by the woman to her GP to talk about those results. So what are the things that you should say about BreastScreen as a health professional when you're talking about BreastScreen? Look, a BreastScreen appointment is brief. It takes just 20 minutes, so it's convenient in that sense. It's not going to take a long time. It's pre-booked, so it is something that is achievable for women to fit into their day. All BreastScreen New South Wales radiographers and staff who conduct the BreastScreen are female, and the BreastScreen New South Wales staff won't start the screen until they get permission. So permission is sought, there is a consent form, and at each stage the radiographers will be ensuring that the client is comfortable and be checking in with regards to that consent process. And when it's time to screen, a female radiographer will position and compress the breast in an X-ray machine to take a picture. And the radiographer will take at least 2 pictures of each breast, and each picture takes only a few seconds, so it's over quickly. So the staff will make adjustments if anything is uncomfortable or sensitive, and they can stop any time. So if a woman is experiencing discomfort, she can definitely communicate that to the radiographer, and adjustments can be made. The service is very safe. BreastScreen New South Wales has the latest equipment and uses the smallest amount of radiation possible while still getting a very high quality picture. Group bookings are able to be organised, and this sometimes is a way for, if there's an existing community group, it's a really great way for women to feel comfortable coming in, within their community group and attending as a group. So we encourage that, and we're very much, we have an entire client engagement team to make sure that we can accommodate existing community groups and group bookings. But the other thing that you can encourage women to do, particularly if you feel that there is a little bit of hesitancy there, or a little bit of anxiety around attending the breast screen appointment, or if it's going to be the first appointment, is to advise the woman that a carer, friend or family member can attend as well as a support person. And I just want to highlight that BreastScreen New South Wales staff are highly professional and experienced in accommodating individual needs. And this includes also for women living with disability, and if interpreters are required. So we don't talk so much anymore about breast self-examination, but rather awareness of breast changes. So this is an image. Look, it might be too small for you to see there, but it is available on the BreastScreen New South Wales website. And this is something that we talk about, is being noticed, being more aware of changes in the breast. And if there is a recent change, acting early to discuss that with the GP. So there are a range of resources available. This is an example of a women's cancer screening checklist, and the reason I've included this today is that this is a checklist looking at cancer screening for the range of different cancer screening programs. And as health professionals, you know, sometimes you are talking to people generally about cancer screening, and breast screening might come up within that discussion. So there are resources where, you know, we have resources available on the BreastScreen New South Wales website, but there's also resources available on the Cancer Institute website that combine the range of different cancer screening programs. And I just wanted to highlight that because they can be useful tools, especially for health professionals that are looking more at overall health as well. Look, the best way to ask a woman that you're chatting to about this is just to say, where are you up to with your cancer screening? Where are you up to with your breast screening? Have you had a breast screen within the last 2 years? And with your knowledge of age eligibility, checking in with that client as to, are they a woman who's eligible to start their screening. So we do have many different resources available. We also have some brief videos. So we have short videos that show a woman attending her breast screening appointment. If you have electronic communications with your clients or patients, please reach out to us. I'd love to hear from you and be able to provide a suitable resource so that you can communicate the message of the breast screen program to your clients. Obviously, we have pamphlets and flyers. They're always available, but we do have a number of electronic communications that we can provide. And now we'll have our recorded presentations as well. That will also be available if you have any staff training events. That is an example of a short video. I'm not sure if the sound is provided there, but I will share that as an attachment in today's webinar, because I do want us to have time to get through. So these are some of the references used today, and I'm happy for people to have a look at those. There's quite interesting evidence coming out, and it's very current in terms of women's attitudes towards breast screening. And I really would like to thank you for attending today, and happy to open up for any questions or discussions. If you can post your questions into the chat, and I'll hand back to Laura for this part of the webinar. Thank you.
Thank you so much for that, Denise. That was wonderful. And I'm sure everyone will take away a lot of really helpful information there. There was a question, Denise, about the screening checklist for multicultural communities. Can we share the link in the chat?
Okay, yes, definitely. That's a fantastic question, and there is in fact a lot of translated pages on the BreastScreen New South Wales website, and in fact the translated resources, we will share the links. So please do check into both the chat and the attachments on the webinar for further resources, but also feel free to reach out to me via my email address there. I'd be very happy to share those resources with people. And there's also a question there from Ali about the cost of screening. So BreastScreen New South Wales is a free service, and there are no costs. It's a free service for women.
Yeah, and just to elaborate that on a little bit further, Ali, so the screening, as Denise mentioned, there is screening, and if any of our clients are recalled to assessment, that would involve an ultrasound and a biopsy, and those are also provided free of charge within the BreastScreen program. So I want to say thank you very much again to Denise. If anyone on the chat or on this call hasn't met Denise in person, then please do so. She is a wonderful advocate for the BreastScreen program, and we're obviously here to answer any questions at any time. I have put up there Denise's contact details, also my contact details. So I'm the Director of BreastScreen Southeastern Sydney and Illawarra, as our service covers the two districts. So it's quite a large and diverse community that we're supporting, but we're very passionate about our entire community. So thank you again for your interest in the BreastScreen program, and hopefully we can keep working together for the common goal of prevention and early detection of breast cancer. Thank you and have a lovely afternoon.